screen full so I can start the presentation. Just 1 second. Okay, can you see that?
Yes, we can see it.
Okay, perfect, perfect. Thank you. So first, I just wanted to let you know that your plan is administered through World Trips. We are International Student Insurance. We are your agents. So feel free to contact us whenever you have a question or need assistance with, verifying benefits, filing a claim, finding a provider, all that. But at the same time, know that you can also contact World Trips. For example, if you contact us after business hours, we are open from 8 in the morning to 6 p.m. Eastern Standard Time. So if you try to call us after business hours, unfortunately, we won't be able to answer, but World Trips is available 364 days a year, 24/7. So you can contact them at any time if you have an emergency or if you have questions. All right. Now, I want to formally start the presentation with a video. This is an overview of the US healthcare system. So let's watch this one first.
In this short video, we will provide an overview of the U.S. healthcare system and how to seek medical treatment. The first step is what to do before you leave home. Before you travel to the U.S., there's some simple things you can do that will make your life much easier and could prevent you from having to pay for things that are typically not covered under international student insurance plans. 1. Prescription medications. If you are currently taking any prescription medications, such as asthma inhalers, make sure to bring a good supply with you, along with your doctor's notes for those medications. 2. Eye test. Opticians are typically not covered under international student insurance plans. So get a checkup before you travel and make sure you have current prescription glasses and contact lenses. 3. Dentist. Make that visit to the dentist you have been putting off. Dental costs in the USA can be very expensive and will likely not be covered by your insurance plan. 4. General checkup. Go to your doctor and have a checkup before you travel, and make sure all your vaccinations are up to date. With some advanced planning and preparation, you can avoid uncovered expenses when abroad. The U.S. healthcare system offers some of the best medical care in the world, but it is complex, difficult to navigate, and often very expensive. The U.S. system will also likely be very different from the healthcare system you are used to back home. In this section of the video, we offer a few simple tips. First, like most Americans, you will need a private insurance plan, either through your school or one that you purchase directly. There is no universal access or national health care like many countries offer. When you seek any medical care, the provider you choose, hospital, doctor, or clinic, will look to you and to your insurance carrier to get paid for their services. There will be no payment from the government. Healthcare can be very expensive in the U.S. Here are a few recent real-life examples. Appendicitis, $60,493. Fractured humerus, $47,445. Fractured clavicle, $18,393. Car crash or serious illness, $150,000 plus. We hope by now it's clear why you need insurance. However, even with insurance, you should still be prepared to pay some portion of the cost of your medical care. Cost sharing is an important element of the U.S. system, so medical care is never entirely free, and each time you access the system, you should expect some cost. While your insurance plan will typically cover the majority of expenses, there will be copays, deductibles, coinsurance, excluded charges, or some combination of these items that will ensure that you pay something. Carefully review your insurance documentation so you understand how these payments work for your plan. When you get sick or injured, where do you seek care? Here's where it can get complicated. The medical system in the USA is made up of a mixture of many different types of providers. Large and small hospitals, emergency rooms, private doctor's offices, urgent care centers, walk-in clinics, specialists' offices, surgery centers, pharmacies, and our favorite, the on-campus clinic. As daunting as it may look, if you keep a few simple points in mind, Seeking medical care does not need to be overly complicated. The main thing to do is, if at all possible, stay out of the emergency room. Emergency rooms in the US are expensive and are designed for life-threatening or very severe illnesses and injuries. If you have the flu or a sprain or minor cut, you can go to an urgent care center, walk-in clinic, on-campus clinic, or doctor's office for a fraction of the cost of the emergency room. The best place to start, if at all possible, is your on-campus health center or clinic. These clinics are typically available at reduced cost or even free, are close and convenient, and even if you end up having to go somewhere else later, will save you money under most insurance plans. Local doctor's offices are a good, affordable place to start your medical care as well. Often called general practitioners or family doctors, these offices typically require an appointment, and some doctors may not accept new or short-term patients. If you can find a doctor you like and get an appointment, it can be the best place to start. Often a more convenient option is a walk-in clinic or urgent care center with long opening hours, no appointment or prior relationship required, and ability to deal with a wide variety of medical issues. These retail providers have become extremely popular. They can cost a bit more than a doctor's office, but much less than an emergency room, and typically accept a wide variety of insurance plans. Of course, for serious or life-threatening illnesses and injuries, go straight to the emergency room connected to your local hospital. They will be prepared to deal with any problem you have and will either treat and release you, admit you, or refer you to another facility. It won't be cheap and it won't be quick, but you are in the right place for a serious case. A doctor at an office, urgent care center, or hospital may write you a prescription for medication. In this case, you will need to go to a local pharmacy to get the prescription filled. There are lots of options available. Walgreens and CVS are two of the more popular nationwide chains, but Walmart and other grocery stores also have pharmacies. In most cases, you will need to pay for the medications fully and then keep copies of your receipts and submit a claim to your insurance company for reimbursement. To review, 1, prepare before you go. 2, make sure you have insurance. 3, plan to pay some costs yourself. 4, stay out of the emergency room and start your care at an on-campus clinic, doctor's office, or urgent care center whenever possible. We hope that you have found the information in this video helpful and that you have a better understanding of the healthcare system in the U.S. For more detailed information about various U.S. healthcare topics, please visit the Insurance Explained section of International Student Insurance, www.internationalstudentinsurance.com/explain.
All right. Thank you for watching this video. So I'm guessing that all of you are already enrolled under a plan. So all of that information will apply to your plan. And now let's talk a little bit more in detail about your benefits, exclusions, how to use your plan, the provider network, and all that. All right. Just to make sure, can you still hear me okay? The audio is good?
Yep, still good. Thanks.
Perfect. All right. Okay, so the first thing that I want to mention is the maximum coverage that you will have per condition. So basically per injury or illness. This includes minor illnesses and minor injuries, as well as emergencies, and that will be a limit of $250,000, okay? This is basically the maximum that the insurance company could pay for a specific condition. And also keep in mind that your plan has an overall maximum limit of $500,000. All right, now, as the video mentioned, there are out-of-pocket expenses included basically on any insurance plan, on every insurance plan. Your plan specifically has a deductible of $45 as long as you seek treatment in network. The network of the plan is the United Healthcare Network. It is widely known in the US, quite comprehensive, and you shouldn't have any trouble finding providers. I will elaborate on the network in a moment. Keep in mind that if you seek treatment out of network, for whatever reasons, your deductible will increase to $90 instead of $45. So we strongly recommend that you try to always seek treatment in network. All right. Now, there is an additional deductible for the misuse of the emergency room. That will be a total of $350 for any illnesses or small injuries that, well, actually only for illnesses that do not result in hospitalization. If you go to the emergency room, in other words, let's say maybe for a flu or for a cold, that's not really an emergency. You won't be hospitalized, but you will be charged a deductible of $350 for visiting the emergency room. So if it's not a real emergency, I would strongly recommend that you visit a walk-in clinic, an urgent care center, or a local doctor. Save the emergency room for actual emergencies. Now, when you use the emergency room for an injury, or if you end up being hospitalized, an actual emergency, in those cases, this deductible, the 350 deductible, this will not apply for hospitalizations and for actual injuries or emergencies. Now, the plan also has a co-insurance. The co-insurance is the amount that it's the percentage that the insurance company, and in this case you, the insured, share to pay towards your eligible medical expenses. This can be a bit confusing, so I'll explain it using an example. All right, so let's say that you have a medical bill of $100,000. Let's say it was something major, okay? Now, as you can see here, the coinsurance is 80% of the first 25,000 and then 100% of coverage up to the maximum per illness or injury. Sorry about that. Okay, here. All right, now, so basically this means that if you have a medical bill of, let's say, 100,000, you will need to pay your deductible first, $45 or 90, depending on where you receive the treatment, and then the coinsurance will apply. So for that bill, you will need to pay basically 20% of the first $25,000. So that will be around 5,000. So basically you will pay your deductible and then 5,000 in addition to your deductible, and the remaining bill will be paid by the insurance as long as it's eligible expenses. Now, for bills that are smaller than 25,000, the standard rule will be that you will always need to pay 20% of come again?
Καλά. Τώρα έτρεχα λίγο, αλλά μπήκα και εγώ σπίτι.
I'm really sorry, I didn't get that. Can you please repeat?
Όχι, όχι. Δεν πιάνει, όχι.
I think you just
Yeah.
need to mute. Yeah, I don't know that I can.
Να πάρω εγώ, να πάρω.
Yeah,
Να πάρω εγώ τότε. Α, όχι, πάλι το ίδιο είναι.
Oh. Oriana,
Α, okay.
could you please mute? Okay.
Okay, all right. So
Ψυχολόγος.
all right, so let's continue.
Ναι, το είχα βρει, αλλά δεν το έχω το χαρτί. Τώρα το άφησα στην Ελλάδα, κατά λάθος.
All right, maybe we can give her a couple of minutes to finish her call. Can the rest of you still hear me? Hear me okay?
Yes,
All
I
right.
can.
Perfect. All right, perfect. Okay, so I think she's muted now. So let's retake the co-insurance just to make sure that you get.
Sorry, I'm so sorry.
Oh, you're fine. Thank you. All right. So as we were saying, the general rule will be you pay 20% of your medical bills, but in cases of a really high medical bill, the limit will be 20% of the first 25,000. All right. Now, for prescriptions, the coverage works via reimbursement for this benefit specifically, so feel free to visit any pharmacy that you would like. It could be a CVS, it could be Walmart, it could be Walgreens, whatever, it's fine. There is no network for prescriptions, so just go to the one that's nearest to you. The one you prefer doesn't matter. And keep in mind that you will need to save your receipts so that you can then submit a claim along with your receipts of the prescriptions so you can get a reimbursement of your eligible medical expenses. In this case, the prescription medication specifically is limited to 50% of the actual charge. So in other words, if your prescription is $200 per se, the insurance company could reimburse you $100 and you will have to pay the other 100. All right, now for the mental health, this benefit is included in your plan. It includes both inpatient and outpatient. So if you need to seek medical assistance for mental health specifically, feel free to use the plan for both outpatient and inpatient, okay? Lastly, I want to mention that your plan includes the medical evacuation benefit. This will be applicable in case that we need to send you back to your home country to continue some kind of treatment or, something like that. Of course, we hope that you never need to use this one benefit, but for your peace of mind, this benefit is included in your plan, okay? All right, now, this is just a brief summary of let's say, the highlights of your plan. A more detailed brochure showing all of the benefits in more detail can be downloaded from the Student Zone at any time. I will elaborate on that in a minute. But now let's talk a little bit about the exclusions of the plan. So this policy, just like any other insurance policy, has its own exclusions, basically treatments, illnesses, injuries, or any sort of medical treatment that is not eligible for payment under this insurance. A great example will be, as per the video that we saw earlier, dental and vision coverage isn't included in your plan. The plan does not cover routine or preventative care, such as annual checkups or physical examinations. That also includes immunizations, any sort of preventative care, meaning that you are not sick, you just went for a checkup, that wouldn't be covered. In simple words, you basically need to be sick or have some kind of illness or injury to use the plan, okay? The plan offers coverage across the United States, so feel free to use it anywhere in the country. If you, for some reason, are traveling to another state and you need to seek medical treatment in that state, that's totally fine. You can use your plan. The same network will apply, the same benefits, everything will be the same. The only exception to this plan will be your home country. You cannot use your plan within your home country. So keep that in mind.
But Antonio, they could use their plan if they travel, like let's say they go to Jamaica for spring break, they could still use their plan in Jamaica, right? As long as they're not from Jamaica.
Yes,
Right.
that is
Okay.
correct. That is
So anywhere in the world, just not their home country.
That is correct, exactly. The only thing I will mention in that sense is outside of the US, the plan doesn't have a specific network. So if you need to use the plan outside of the US, most likely you will have to pay up front and then request a refund. But feel free to use it. Like I said, the benefits will remain the same, the coverage will remain the same. And as long as you use the plan for an eligible illness or injury, then the insurance company will issue a refund of your expenses. All right, now moving on a little bit. So we were talking about in-network and out-of-network providers, right? Okay, so the network of your plan, that's United Healthcare. Like I was telling you, this one is quite popular, widely known in the US, quite comprehensive. You shouldn't have any trouble finding doctors, hospitals, urgent care centers, specialists, and more using this network. For your reference, we listed here a hospital and also an urgent care center in your area. These two are within the network. And the biggest benefit of seeking treatment in network is not only the deductible will be cheaper, as we discussed before, it will be basically only $45 in network, and it will increase to $90 if you go out of network. But also, another benefit is that you will only need to show your ID card to the doctor or the hospital, and if they are in network, they will send all of the bills to the insurance company directly, so you won't need to pay upfront. Of course, if you go out of network, you are required to pay upfront and then request a refund. So we strongly recommend to get familiar with the network of your plan. And I will show you in a moment how to find providers using your zip code. It's also really easy to do. I will show you in a moment. This we already discussed, how to identify where to seek treatment. If it's a non-emergency case, go to an urgent care, a walk-in clinic, a local doctor. But if it's an emergency, of course, just go to the nearest emergency room. Prescription medications, we already discussed. These are gonna be on a reimbursement basis. And it will be covered up to 50% of the actual charge. There are a few benefits per se, some treatments that need to be pre-certified. These include CAT scans, MRIs, hospitalizations, and any surgical procedure. Any sort of surgery needs to be pre-certified. What does this mean? This basically means that the insurance company needs to be notified before you get any of these treatments. The pre-certification can be done by you if you have the ability to do it. If not, a family member can do it for you, or the hospital can contact the insurance company to verify your benefits and start the pre-certification, or you can let your school know so they can also inform us and we can help if needed. Okay, there are different ways to start the pre-certification, but in simple words, it's just notifying the company that you will need some kind of surgery or CAT scans or anything like that, okay? All right. Okay, this also we already discussed. This is basically what I was telling you before, guys. Although ISI is only open from 8 in the morning to 6 p.m. Eastern Standard Time, World Trips, the insurance carrier, they are open 24 hours a day, basically the entire year. Anytime, any day, you can always contact World Trips. They offer assistance in different languages, such as English, Spanish, Mandarin, French, and they have a lot more. So whenever you contact World Trips, if you ever need to do that, you can ask them if they have a representative that speaks your language, and they will be happy to connect you with them. They can also help verifying benefits, giving you claims status, helping you finding doctors, anything related to the plan. Both ISI and World Trips can help. All right, now we were talking about the student zone a little bit. This is the portal where you will have access to your insurance documents, where you can find doctors in your area, where you can learn more about the plan, find the claims form, anything relevant, important, related to the plan has been summarized on this student zone. So I would recommend that you bookmark the link or keep it handy somewhere, because when you don't know where to go to your student zone. It probably has the answers. Of course, you can always contact us for questions. But yeah, the student zone is a great resource for that. All right, before we start with the questions, I actually want to take a moment to show you the student zone really quick. So let me change screens. 1 second. For this one, I do need to go to Chrome, so just give me 1 minute. All right. Okay, got it. Okay, can you see your student zone now?
Yes. Thank you.
Perfect. All right, so there's a couple of things that I want to point out here. The first thing is how to find a doctor. You will want to go to doctor hospital search. You can either click here or on the big icon, doesn't really matter. You will see these logos. If you're in the US, you will want to click on this one, United Healthcare. And then I believe this is a pop-up. I don't know if you can see that. Can you see that pop-up?
Yeah.
Okay, perfect. As you can see, the website basically detects your location automatically. I'm currently located in our office in Mexico City. But here, for example, you could change the zip code to, let's use this one. Let's use Florida. And once you enter your zip code, you click update location, you will see these options here. You can find providers by doctors, medical groups, or you can find hospitals, clinics, laboratories, etc. You can also find a doctor by looking by services and treatments, basically, or condition. The only option that will not be available to you guys is the cost estimates. This one won't work, but if you want to get an estimate of the price, you can always contact the hospital or doctor directly to inquire about it. All right, now let's say I need a hospital. I want to click on places, then I want to click hospitals. And as you can see here, the website will give me all of these options. It's up to you which one you want to visit. You will have to call them. You can see their number here. You will have to call them to make your appointment, and you can also see their mailing address in here. So this is up to you. We do not assign specific hospitals or doctors for you. Feel free to choose any that's in network, okay? After seeking treatment, any sort of medical treatment, whether it's in network or out of network, you will want to file a claim, and you can go to the claim center where you will find the form in English and Spanish. These are quite simple to fill out. They basically just ask you for general information such as your name, date of birth, and details of the accident or the illness that you are seeking treatment for. Once you have filled out that form, you will want to send it via email to service@worldtrips.com. That's the claims department directly. And after you have filed your claim, I will strongly recommend that you sign up for your Mesa account. The Mesa account will give you access to all of your claims on file, and any updates regarding your claims will appear on your Mesa account. So you will want to stay on top of your claims if you ever need to use the plan, and you will want to create your account so that you can check if it has been paid, if the claims department needs some kind of additional documents, any updates will be on your Mesa account. So it is really important that you sign up after you file a claim. The other items, if you want to revisit the video that we saw earlier, or if you want to check out a few more videos about other topics that will be helpful for you, you can go to the video overviews. If you need to download additional copies of your ID cards, your confirmation of coverage, any of your insurance documents really, you go to My Documents and you enter the details here, then you click Search Now, and that will give you all of your documents. The other are just general information, like for example, this one. Feel free to use telemedicine services if you would like. This one specifically works via reimbursement. So if you ever need to use Teladoc services, keep in mind that you will have to pay upfront and then request a refund. And you can find all relevant information about that here on your student zone, as well as more details about how to seek treatment, how to identify what kind of facility to visit, and all that good stuff. Lastly, if you want to contact us, you can click here. You will see this box. You can type an email. This email will be sent to ISI directly. We reply to emails pretty quickly. You should have a response within 60 minutes at the latest. unless it's after business hours. But if you need to speak with an agent after business hours, you have the numbers, the 24-hour numbers here. So this is also why I recommend keeping your student zone handy, because you can find all contact details and details about your plan here. All right, now it's time for questions. I will stop sharing my screen.
Service.
Mhm.
And I do have our office works in partnership with Advent Health. So all the services that the students get are actually billed through insurance. Everything is through Advent Health. We
Mhm.
are in network, obviously, for this insurance. So, but it says on the exclusion, some of them say as long as they're not treated at a student health center, but it's not Stetson providing this service. It is actually Advent Health.
Yes. Yeah, and that's actually fine. That's fine. Yeah, they can use the plan at Advent Health. It won't be considered as a student health center because it's not really a Stetson's.
Correct.
Yeah,
Okay.
so that's
Perfect.
perfectly fine.
And I do have another question. So I read the plan and it is for illnesses. Obviously, it's not for preventative or annual checkups or anything like that. But how about diagnostic testing? Like if they come in for, let's say bellyache and we need to order a test or something, or STI testing just to make sure it's nothing pelvic, it's not inflammatory, is that covered? Because one of the exclusions is also no sexually transmitted infections testing.
Well, that is specifically STDs that unfortunately, or STIs, those unfortunately won't be covered. That's an exclusion of the plan. There's not much we can do about that. However, diagnostic testing in other cases could be covered. For example, let's say that maybe we have a student who is having some kind of symptoms and he doesn't know what's going on. He goes to the doctor asks him to, do all the testing, and it turns out that he has appendicitis. It's the first thing that's coming to my mind. That's not an exclusion. Appendicitis, it's not an exclusion of the plan. So in that case, because it is an eligible condition, also the testing would be covered. So basically, the testing will be covered if the condition itself is covered, eligible under the plan.
So, but if let's say we do all kinds of testing and we're unable to find, like they come out okay, and it wasn't, it was a bacteria or something in the stomach, it was an infection, something like that. If it's, so the actual testing will not be covered if they don't end up with a specific condition?
It will actually depend on case by case. I mean, if the student had symptoms, he most likely, or they per se, will have their
Something.
yeah, they will have something. So in that case, most likely it will be covered. There will be, well, the way the claims work is after the student seeks medical treatment, the doctor sends the medical records to the insurance company for review. There's a few things to keep in mind. For example, pre-existing conditions. We could use an example of, let's go back to the appendicitis. That could be covered, but turns out that if it's a pre-existing condition, it will show on the records, on the medical records, and the insurance company will deny it because it will be a pre-existing. I believe your plan has a 12 to 6 month waiting period
No,
for
no, 3 months. 3
3
months wait.
months.
Oh, 3 months. Perfect. Thank you. Yeah, so in that case, for example, that could be excluded, but the general rule will be we have to wait for the medical records. Like the medical records will determine whether something is covered or not.
Okay, I see. So the 3 month waiting period, and this is my last question, I promise. And the 3 month waiting period will be because this insurance renews every 6 months, correct? We pay for a full, for a semester. So it will be, we see an student in August and they're seeing, I guess they have to wait the first 3 months. So they will only have the other 3 months to be seen, or it does roll over. Those 3 months roll over.
It rolls over.
Yeah, they do roll over, yes.
Okay.
So basically, even let's say that a student was enrolled for a whole year, the pre-existing condition will then be covered for the first 3 months, but it could be covered for the remaining 9 months. And let's say that the student renews their plan, the same plan for a second year, the pre-existing condition will continue to be covered because the 3-month waiting period was already met. It
Perfect.
will only be applicable again if we let a student expire. Let's say their policy expired on July, and then we re-enroll them in November. There was a gap in coverage. The student will be giving a new ID number, and then the 3-month waiting period will apply again.
Perfect. Thank you.
And we are trying to avoid that, Joanna. We're going to keep everybody continuously enrolled until graduation, so that they don't have to go through that 3-month waiting period again.
Perfect.
Yes,
Thank
but
you,
all of
Paula.
our students should be covered starting November 1 for pre-existing conditions. So, because August, September, October would be their 3-month waiting period, and starting November 1st, they can be treated for pre-existing conditions.
Yes,
Okay.
that is correct. On that note, I would also like to add that yeah, continuous coverage, super, super important. And we have a back day window of 30 days. So if you have a student that expired, let's say yesterday, and for some reason we overlooked that student, no problem. I can go ahead and reactivate the policy, and that will ensure continuous coverage. So if you ever have a case like that, just let me know, and keep in mind that we can reactivate policies we can backdate them for up to 30 days, basically a month.
Okay.
All right.
Any other questions?
Sylvia?
I have a question.
Mhm.
And that is about the
I
pre-certification.
can hear you.
Oh, hello, Yona. Just 1 second. Let me answer Susan's question first, and then I'll be happy to answer yours, okay?
So if you have pre-certification and you need to notify the insurance, if you're at a doctor's and it's kind of urgent, how long do you have to wait? Do you still have to do it? Is there an exception when it's urgent?
Well, normally when it's let's say a surgery or a hospitalization, those are normally the benefits that need to be pre-certified. Normally the doctor or the hospital will be proactive about it, and they will call the insurance company right away to verify benefits and start the pre-certification. Um, there is a standard rule per se of 48 hours. Pre-certifications must be done within 48 hours after a student was hospitalized, for example. And like I said, the pre-certification can be started in different ways. Of course, if it's an emergency, most likely the student won't be able to start that process on their own. So it can either be the hospital being proactive about it, or if you know that a student is at the hospital or had an emergency, let me know too, so that I can also jump in and start working on the pre-certification. Or also a family member can start that process. It's really not complicated. There's no forms to fill out or anything. It's basically just a matter of notifying the insurance company, and then the provider, the hospital, will basically do the pre-certification in the back end with the insurance company. Does that make sense?
Absolutely, thank you.
Perfect, perfect. Um, I believe Joanna had a question, but it looks like she left the meeting. Oh, I think you're muted, Joanna. All right. So, do we have any other questions about the plan, how it works, claims, benefits, anything?
I think we're good. Thank you, Antonio.
All right. Perfect. So then, yeah, like I was saying, I will go ahead and, well, first off,